when parents with ADHD are raising children with ADHD. That means that a child with ADHD is likely to have a parent with the same condition. Point 1. This can introduce certain challenges that parents should understand. Challenges when you and your child have ADHD. Studies have also found ADHD interventions for kids are often less effective when one or both parents also have ADHD. Add siblings without ADHD, conflicts, attention pulled in different directions, feelings of resentment by the child who requires less attention. All these factors combine to create a parenting role that can quickly become overwhelming. When a parent has undiagnosed or untreated ADHD, the difficulty level is even higher. For example, a parent with untreated ADHD will undoubtedly have difficulty following through with treatment recommendations for the child. Adults may also struggle with other symptoms of untreated ADHD, such as difficulty multitasking, forgetfulness, impulsivity, low frustration tolerance, mood swings, and restlessness. If a parent has ADHD, they may also have a challenging time being consistent with their child. Parenting skills will be affected by the parent's ADHD. Undiagnosed or untreated adult ADHD can make the stress of parenting a child with the condition even more difficult. Lack of consistency, difficulty coping with frustration, and other symptoms that interfere with daily functioning can make it hard for both parents and children to cope. In the past, ADHD was often thought of as primarily an academic or school issue for children. ADHD, however, is a 24-hour-a-day condition. ADHD causes impairments in school or work functioning, but it also significantly impacts families and social relationships. There is even a high incidence of divorce in families in which a member has ADHD. When a child is first diagnosed with ADHD, it is also essential to screen the rest of the family to determine whether additional family members have ADHD. Treatments for ADHD often involve the use of medications, but may also include psychotherapy, skills training, and self-help strategies. In addition to making sure that both you and your child receive appropriate treatment, there are a number of self-help techniques that you can implement in your life to make parenting more manageable. Make a list of your strengths and some of the areas where you struggle. For example, you might be great at helping kids with homework and making sure they get to appointments on time, but you might struggle with being consistent in terms of discipline. Once you know which areas are more challenging, you can find ways to deal with them more effectively. One approach that can work is to share certain tasks with your partner, if you have one, so you are both doing the tasks that play to your strengths. Every parent, child, and family has different needs. A one-size-fits-all approach won't solve your unique problems. Instead, choose the tools and strategies that will work to address your needs. Learn about behavior management. Create expectations and determine which behaviors are unacceptable. You might find it helpful to print out a family rules chart and post it in a visible area so that everyone can remember what the rules are. Create structure. Reduce distractions. Practice self-care. Remember your strengths. Having ADHD can make certain things more challenging for you and your child, but it also means that you both possess creativity, resilience, and spontaneity that can help you succeed. Creating structure in your home, minimizing distractions, and practicing self-care can also help you and your child stay on track.